How are you, my dear students? In the fourth topic of this unit on drugs and substances that are psychoactive, we learned about the signs and symptoms of substance use. And we said that when someone is using substances, there is usually an unexplained change in behavior, in appearance, in relationships, in performance at work, at school. The important thing to take away from today's lesson is unexplained. If you cannot explain by any other explanation, then it's likely that it is drugs of abuse that are making this person change in the way they appear, they behave, they perform, and they relate with people around them. So when you're looking for these changes, you look at these lines, you look at life patterns. For example, the daily routines. Someone has a way, they wake up, they work, they sleep, and there's a pattern. When there's a change in the daily routines. You look at work performance, how they remember tasks, how they perform in school, at work. The intellectual capacity is likely to change in a way that you notice. You look at their perceptions, their ideations, how they think, how they reason, their ideas about things. Have their beliefs changed from what you knew in the past? This will likely point to use of drugs if you have not identified any other reason that you know could be causing this. You would also look at the appearance and the functioning of their body. How do they groom themselves? Have they changed their grooming? Have they changed the way they walk, the way their eyes look, their skin, their general appearance? And lastly, you may actually get to catch this person in the action of using drugs. You find them smoking or drinking, or you hear about it from their friends, and so you've caught them in the act, and this is also a sign that you should not neglect. Above all, always have an index of suspicion that if someone changes their behavior, their functioning, their relationships in a significant way, and you cannot explain this change by any other reason, then always suspect that they are drugs, and then go on the watch out, and you may see all those other signs and symptoms we've mentioned. Thank you. This is your summary doctor, Dr. BMS, and see you in the next lesson. Bye-bye.